Alright, welcome back folks. It is Friday and 6:30 Central, and we're going to be talking today about therapy. Going to be a heck of a topic because there really is a lot to go over. We're going to give everything a moment to catch up, and then we'll get started here. And looks like we are live and moving, so welcome. We're going to get kicked off here in just a couple of seconds. And I'm still getting used to this whole platform just because of the fact that, I'm not used to just flicking on my my iPhone and having it, what do you call it, just like all of a sudden work. I'm used to doing things like game streaming where I've got all sorts of setup and software and 100 different things to do, so it's kind of like, you know, it was just a little bit strange for me all of a sudden to be like, oh look, all I gotta do is press the play button and here we are. So, okay. If you want to let me know if you can hear me well, I'm gonna get started. But I'm assuming somebody would have probably told me at this point in time if you couldn't hear me. Looks like we've got a few folks that are already in, and we can hear. How's it going, Jay? It's good to see you. That's a friend of mine there. Used to play a lot of Call of Duty together before I didn't play Call of Duty anymore, I guess. I don't know. So a couple of things we'll talk about before we get started here is that we will be turning into a podcast over the next couple of months or so. I've got a lot of software to buy. I've got a lot of things to do. Got a lot of things to get ready, and it's going to be a podcast talking about a couple of different things. For starters, of course, about therapy, about stigma, about all sorts of topics that go along with mental health, but at the same point in time, we're also going to talk about the professional side of it too. So for people who want to be therapists in the future, or for people who want to be counselors, psychologists, we're going to have a lot of discussion on that. Hopefully, if we gain a little bit of a sustainable mass, maybe we can get some guests here and there. I'm looking to have the guests kind of be about both people who suffer mental illness and feel like they want to tell their story, but also for people who want to, come on and talk about certain things. About mental health, like so other professionals that have expertise in areas that I necessarily do not. So, but yeah, there's really, really a lot that can be done and a lot that will be done. So first things first, let me get you a link so that you can follow along. All right, this is the link that if you're interested in following along, you can kind of see what we're talking about. So why am I deciding to talk about what therapy is like? Probably first because I see I'm being assaulted by hearts right now, and without even looking, I can tell you who's doing it, but that's okay. So why am I talking about therapy? The reason I'm talking about therapy is because there are a lot of people that need it, want it, but there's fear about going into therapy, but there's also ignorance. And when I say ignorance, I don't mean in a negative way, saying like, okay, you're ignorant, you have no idea what you're talking about, but a lack of understanding and a lack of knowledge. And I feel like that is kind of where problems start to come in, because at some point in time, people start to get brave, and then the big question comes, how do I begin? So the topics that we're going to cover today are, we're going to talk about kind of three different sections. One of them is called Before Therapy, Making the Call, as you can see on the link that I provided. One of them is During Therapy, and then After Therapy, and then we'll have some final words, have times for questions. As always, if you have a question or a comment, you do not have to wait for me. Just kick it on in there, and we'll get going. So... if you do look on there, there's a Twitter, YouTube, and blog page for someone named K. Scott, somebody that I've kind of been working here and there with regarding some of our stories. So please check out her page as well. And we're going to go ahead and get started now that everybody's here. And please feel free to share this far and wide. I'd love to have other people join us. I've made it public so we can get some other folks going as well. So, okay. So one of the first questions that people ask is, where do I actually begin? I have made the decision that I want to get into therapy. I have decided that this is for me, but I'm completely confused about how to get started. And there is a lot to be confused about. There are a lot of things that you may not know. And so, one of the first things that people ask is, okay, well, how do I find a therapist in the first place? Like, how do I even begin? And there's many, many different ways you can do it. Um, so when you're looking for therapists, obviously if you have an internet connection, if you have a smartphone, or if you get to a public library or somewhere that you can use some sort of internet and computer setup, what you can usually do, I mean, there's like going on the virtual yellow pages where you can just say, hey, go in there and just look up counseling, look up therapy, and you'll probably find a big old block of things around you. You can do things like putting in your zip code. That's usually one of the easiest ways to check, because obviously you don't want to find a therapist that sounds amazing and find out they're 50 miles away from you. But if you want, however, to get a little bit more of a pointed look, what you can do is go on a service such as Psychology Today, which I'm going to bring up for you and get you a link to that. Now, Psychology Today is an entire service based on giving people the ability to search. But what's really, really wild about Psychology Today is you don't just put in, looking for a therapist and your zip code. Instead, what you do is I'm looking up therapist, psychologist, counselor, zip code, and then it's going to ask you a whole bunch of different questions that'll help you match up with your needs. So, for example, if you're having an issue with an eating disorder, you can narrow it down to say, I'd like to see people that specialize in eating disorders. So I think that's really, really kind of a cool way to do it, because in a way you're able to just start the narrowing down process, because one of the things that people are actually asking when they say, how do I find a therapist, is not just how do I find a therapist, but how do I find the right therapist? And that's really an important question, and there's a lot of things that go along with whether or not a therapist is going to work with you. There's the logistic stuff, such as scheduling, such as how far they are from you, transportation, what sort of insurance they take, and we're going to talk about that here in a few moments. And then, of course, there's just what I like to call the fit and the feel. And it's interesting because obviously, of course, just talking to a therapist on the phone or just looking at their bio doesn't give you everything you need to know, but it'll start to give you a good feel. So you can kind of look at their picture, you can look at their write-up about, how they like to work, what they work with. They'll usually talk a little bit about their personal life, so kind of humanizes us a little bit. And you start to get a feel of like, okay, this might be a person I'd like to at least look into. And so when you go into that search, kind of have in mind what you're looking for. And there's going to be questions on your mind, tons and tons and tons of questions. And when we get to making the call, we'll tell you about how you can ask those questions and good ways to kind of dig out answers. So having in mind things like, what do I want to work on? Like, what is my ultimate goal here? Am I going through depression, anxiety, alcohol, drug problems? Am I going through issues with trauma in the past? Just phase of life, having a little bit of difficulty with what's going on, and everything in between. So that's what's really, really great about Psych Today, is that you get the ability to kind of narrow down and say, okay, this is the kind of like the list of what I'm looking for, and then the next thing you know, a bunch of things pop up. Well, now there comes a bigger problem, because all of a sudden, when you look at these things, there's like a bunch of different letters after these people's names, and you're like, well, I don't have a damn clue what any of this means. So how do we demystify that? And I've given a little bit in section 2 of my link, a little bit of kind of a breakdown, but I'm going to go over that today. But before I do that, there is one other really good way that you can search for therapists. If you have a very, very specified issue, you can often go on and find forums that will, or not forums, but websites such as the International Society for Traumatic Stress Studies, which is solely going to be working with, high anxiety, PTSD, trauma, acute stress disorder, and things that are, from a traumatic abstract nature. So now you have a really, really specialized website, and you know when you go on that all of the people listed there are going to be specifically for trauma. So, you know, it can help you narrow it down even more than psychology today. Not to say that psychology today is not really a good way to go about it, but at the same point in time, you know, if you already know exactly what you're looking for, and you can find a group, organization, or a website that helps you specify, then I think that's usually a pretty good way to start, because then you're not kind of wading through some other stuff that may not be as appropriate for you. Okay, so let's talk about the letters, because there are dozens and dozens and dozens of them. And as you can see, I've broken them down into a lot of different types, and for some reason I did not make bold all of my leaders, like where it says medical, psychological, clinical, and such, but I'll have to fix that and learn my lesson. But so let's go ahead and start with the medical. Okay, the medical are going to be having letters such as MD, DO, PA, NP, you know, these sorts of things, and these are people that work almost exclusively on the chemical side of things. So when you go to an MD or a psychiatrist, and we're going to kind of break down some of the words as well, when you go to an MD, you're going to be wanting to look more at the body, the chemical structures, the physical structures of your brain, to you know, figure out how you can help. So people who suffer bipolar disorder, people who suffer schizophrenia and need to be on medications, you can't go to a psychologist or a therapist or a counselor and get these same things. So if you're looking for medical assistance by way of pills and shots, then obviously your doctors, your physician's assistants, and your nurse practitioners are going to be the way to go. Most commonly, as I say here, most commonly the treatment is going to be a pill. It's going to be a shot, because there actually are shots that you can take for certain things like psychotic disorders that'll last an entire month. And what's really cool about that is that one of the hard parts about things such as severe forms of schizophrenia and severe forms of bipolar disorder is that people will start to feel better and then they'll stop taking their pills. However, if they get a 30-day shot, then it's in the body in a slow release, and then you have a much higher chance of having med compliance as opposed to a pill. Okay, so as we move down the scale, as soon as we leave the medical side, we are no longer talking about anything relating to pills, medications, or shots. Then you get to psychology. And psychology is going to usually have something following their name that says PhD or PsyD. There's also doctorates of social work such as DSW, but in psychology, these titles will always carry the name doctor, so they can be referred to as doctor. And but we can remember that there is no medical licensure or training when it comes to a psychologist or a doctorate of social work. So the doctors can do all sorts of psychotherapy, just like anybody that's a clinical licensed therapist like myself can do. However, the difference is they can also do a lot of things such as batteries of tests, such as personality testing, IQ testing, and a lot of different things that can help you kind of figure out what's going on in your life from a bit of a more I guess, clinical perspective as far as testing. So a good example is like the MMPI, the Minnesota Multiphasic. This is something that can help look for certain disorders and certain personality issues that might need to be attended to. And so what the benefit of having a psychologist is that you can go and not only engage in therapy, but you can see other psychologists and get together and do testing to kind of find a little bit more of a pointed view of something that might be going on. So once again, if this is a severe issue such as bipolar disorder, schizophrenia, severe clinical depression, you know, it's always a good route that you can take because you can get the testing alongside of it. And it's interesting because actually the clinical licensures can do testing as well, but not for the same reason and not nearly the same amount. So now we're going to take a step down and go to the clinical licensure, which is where I am. And the clinical licensure, will typically be the same thing as a social worker or a professional counselor or a marriage and family therapist. However, at this point in time, they've had enough time under their belt and enough supervision that they no longer have to answer to anybody. So, for example, for 2 years that I worked as a professional counselor, I had to answer to somebody, I had to be under constant supervision, and someone had to sign off on a lot of what I do. Since back in September, when I passed and became a clinical professional counselor, I am no longer having to answer to anybody, which means I can do things such as run my own private practice, or the good news that I've been sharing around a lot, I can now be, I'm now have been placed as a clinical director, and as a clinical director now, not only do I not have to be supervised, but I can now provide the supervision. So if there's another counselor who needs to work under someone supervised, I can do that. And it's the same thing with social workers, LCSWs. So instead of licensed social worker, it's a licensed clinical social worker, meaning that they no longer have to answer to anyone else. And also they can, again, provide that same level of supervision and work on their own and be much more autonomous. So it's pretty cool. And then another one that's a little less common, but still very strong, LMFTs, licensed marriage and family therapists, can do the same things that I can do. However, with LMFTs, there tends to be a little bit of a push towards the family and relational aspect, and that's really important in a lot of different ways because, sometimes family therapy is something that's very needed. Very commonly, we say the disease of mental illness is not something that goes after just a person suffering it. It can also affect the family as well, so having the family involved. But licensed marriage and family therapists, of course, can also kind of tackle just strictly family therapy and marriage therapy as well. Not to say that we cannot as LCPCs or LCSWs, however, they tend to have a little bit more practice at it. It's going to be a little bit shorter for the next piece because now we're talking about non-clinical but still professional licenses. So now we're talking about LSWs, licensed social workers, licensed professional counselors, marriage and family therapists. They can do the same amounts of things that we can do, the same types of programs, the same types of therapies, but instead now we have to have those, the people at this level have to have supervision in order to do what they do. They cannot just go out and what we call hang a shingle and begin their own practices. Then underneath that we also have certifications. Now certifications are a really cool way that if you want to get into the field but you don't necessarily want to go to graduate school, either 2 to 5 years after you finish your bachelor's degree, you can also go for certifications. And now certifications treat things, however, they're usually, I don't want to say stuck, but they're usually kept to treating exactly what they're trained for. So one of the big examples is a CADC, which is a certified alcohol and drug counselor. So a CADC can do types of therapy, but generally regarded only towards things like drug and alcohol addiction, abuse, dependence, and so forth. Another one is a registered art therapist. Art therapist is a really good certification because art therapy is such a cool, creative way to kind of get out a lot of what you're feeling and to really find a lot of coping and healing through some really super creative processes. And there's a lot of different ones too. Remember that these are not licensed positions, so if you're looking strictly to see someone who is a psychotherapist, you are going to have to go to somebody who is professionally licensed. So that again would be your non-clinical positions, your clinical positions, again, which is where I'm at, or your doctorates, and to some extent the NDs. There are some psychiatrists that still practice psychotherapy, not maybe as common. Okay, I got a drink of water here. Alright, so let's talk about how to make the call. You've found your therapist, you've got a good feel for him or her, and you've made your decision that this is who I'm going to try. Say, lost you. Am I still going here, or what's going on? I just want to make sure I'm still up so I'm not talking to a blank screen. So if somebody can still see me, just let me know so I know I'm still going here. And we'll see here in just a moment. Hopefully somebody is hearing this. Okay, I'm good. Okay, just want to make sure I'm still good because I didn't want to, every once in a while, I'm still a little bit touchy from the last time I tried this with that other really nasty software package that I had that would just fall to pieces after like 5 minutes, and it was just such terrible frustration. Okay, so let's get back to the topic. We have gotten to the point where we want to make a call. We've got a therapist picked and we're ready to start asking some questions. But one of the big things is you have to ask yourself, well, what do you even ask a therapist when you first talk to them? What are you going to hear? What do you need to know? What do you want to know? And again, it comes back to a lot of the a lot of what you're looking for. So as you see here, I talk about, therapists are indeed balancing an enormous schedule. So oftentimes it can take a little bit of time for us to get back the first time, but usually a good therapist will try to get back within 24 hours, so long as it's not a weekend holiday and so forth. A few exceptions, like I said, the weekend holidays are realistic barriers. While connecting, this is the time to start feeling this therapist out. So now, instead of going on a website, seeing a picture, reading a bio, you're actually talking to the individual, getting a feel for how they talk back. Do they, have a tendency to be very respectful of what you say? Are they empowering? Are they encouraging? Are they giving you free information, such as, this is who I am, this is how I work? These are all very important things because you don't want to just blindly walk into a therapeutic practice, if you will, and not have any idea of what you're getting yourself into. So things that you really, really want to know, the very, very, very basics. How do they work? What's the address of where they are? Do they have any specialties? Are they going to be right for you as far as their expertise? Phone number, scheduling, do they take your insurance? I always like to tell people to ask 2 questions right off the bat. And when someone calls me for a brand new appointment, I will ask these 2 questions right off the bat. Before I waste your time or my time, let me first ask what type of insurance you have. Because if you do not have the type of insurance I have, there's going to be very little point unless you really want to go into private pay, which is definitely significantly more expensive. Do you want to, continue with this? But that doesn't mean that if you don't have their insurance that the conversation needs to just, end in a hang-up right there, because therapists who are unable to take you either for schedule or for insurance reasons should be doing the right thing and trying to point you to somebody that can help. So yeah, you definitely want to learn about that. They're going to also ask you some questions, such as, what are you looking to get out of therapy? What are you looking for in a therapist? And then at this point in time, they're going to give you a brief rundown on how they work. So something you might hear from someone like me who works under an analytic perspective is, let's say I get a call, we'll use our fictional person from last week, Jennifer, and Jennifer says she's going through a lot of depression. She didn't necessarily have trauma or abuse when she was young, but she didn't have much of a good relationship with her parents. They split up. There was a lot of neglect, and they didn't really actually pay much attention to her. So I might say something like, "Hey, well, Jennifer, first of all, I'd like to tell you, or I'd like to say that I appreciate you giving us a call, and I know this can be difficult. So let me tell you a little bit about how I work." And what they want to do now at this point in time is kind of tie in the issue that the client is going through, and also tie in how you plan on tackling said issues. So the question, of how might I be able to help that might be answered by saying, okay, well, you don't have to use all the fancy words necessarily, but I might say, well, I tend to follow a bit of a pattern-based perspective. I like to see the patterns that people play in their day-to-day lives, including, the mask that we wear. Sometimes we present the real, genuine us, and sometimes we don't feel safe, so that we end up having to make up sort of a mask, sort of a presentation that we're going to give to the rest of the world. Pardon me. And in doing so, what ends up happening is, we like to take a look at those patterns and see which ones are healthy, which ones are not, and through this discovery, try to find out sort of where some of these issues started, how they got worsened, and what we can do about it. We're going to take a look here. We got a comment from Kathleen who says, "I feel like no one wants to take me on. I've asked a couple of that said they were available, and halfway through talking to them, they dropped me like a hot potato, but they said they were too full." And then she also says, and yes, that is awful to hear. It's unfortunate because a lot of people, if and this is kind of an important thing to talk about, and I'm glad you said that because this is actually a realistic thing. Let's say that you call up and you want to talk to me, and let's say that you present a problem that I'm really not much of an expert in. Part of our ethical conduct is that we have to not take clients that we just do not feel a lot of expertise in. So I have, for example, I have extremely little experience with the autism spectrum. So if somebody calls up and they have someone who's got a relatively hard case of autism spectrum disorder, I'm going to have to explain. Now, it doesn't mean I should just drop you and say, like, oh, sorry, no, can't help you. Instead, what I should do is, say, like, if you don't mind me using that for a second, like, oh, Kathleen, I hear what you're saying, and I feel that you are deserving of help. However, I think it's important for me to let you know that that's not necessarily my specialty, but what I would like is, if it's okay, I would like to talk to you a little bit more, get some information, and see if I can pass you off to some really good people. So just by doing that alone, I've connected with you in a way and said, like, okay, I understand that I may not be the right person for you, but I want you to feel heard. I want you to feel known and feel seen. And then let me go ahead and take over and try to find some connections for you. The thing is that they are areas that they specialize in, such as depression or PTSD. I only contact therapists who state that it's in their specialty. Well, then that can definitely be kind of part of the problem too, because some people do a little bit of false advertising, not necessarily as in they are not therapists, but they may broaden and say that they're experts on certain things, and they may not necessarily be, which is really not ethically appropriate to do. Again, so me, who has very, very little experience with autism spectrum disorder, I shouldn't be running around saying, hey, just FYI, I'm an expert in autism spectrum disorder. In my case, I'm a specialist with PTSD and acute stress disorder, anxiety, so those are things that I would kind of like to put out there. So, okay, and then last thing we'll talk about a little bit here is before making or while making the call is typically if you have a way to download and print some information, usually a therapist to try to save you a little bit of time and effort will send you forms in advance, such as informed consent forms and also like cancellation policies, fee policies, all that kind of stuff. And I mean, if you can't do them, usually you can just show up a little bit early and you'll be able to fill those out there, but if you can bring them in before time, that's always great. They will usually ask your insurance and get some information before they see you the first time, so they can get a solid yes or no whether or not they can accept you, and then of course what your copay, if any, would be. Okay, first things first. A little bit more water because my voice was hurting a little bit there. Now let's talk about therapy itself. For those who have never been in therapy, it's a frightening process. And let's get that out of the way right now. It is a frightening process because no matter how hard you try, no matter what you think, say, or do, you come to the realization at some point in time that you're going to have to open up. Even if you're going not interested in really looking at the deeper processes that are going on, you're going to have to open up on painful things before they get better. So what I'm looking to do now in this second section of this live stream is they actually start talking to you about what to really expect when it comes to therapy, and how maybe I can hopefully temper a little bit of the anxieties and concerns. Okay, so you show up, you've done your paperwork, and it's time for assessment. Assessment is not necessarily what it sounds like. You're not going to walk in my door and I'm going to hand you a bunch of cold and clinical tests unless you legitimately signed up for a test battery. Assessment is more so, let's give you an hour to talk about everything that you need to talk about. I'm going to give you some more information about me and we'll see if we're a good match. So assessment is going to be somebody walks in and they've told me that they have issues with depression, and I've gotten a couple of answers and a little bit of information, but now it's time for me to really suss out and kind of figure out what's going on, and for me to start formulating things such as how I'm going to approach helping and what other resources might be available. I will tell you straight out the door that the very first session is going to feel a little bit cold and clinical, because there's going to be a lot of back and forth with questions, and people are going to ask things such as, well, tell me a little bit more about this, expand a little bit more about that, and it's going to be a little bit rapid fire. So you have to, I like to tell people that so they can expect that, and I put. Also down there, please do not be afraid, because once the first session is over, that's time when things are going to be given a chance to warm up and get less formal. Let's see here. We do have a couple of comments. Let's hold off and take a look at those. Jay says, I'm scared to seek out counseling for that reason, not just for that reason, but that's one of them. Referred me to the insurance website, which is how I found them in the first place, and unhelpful. Yeah, it's unfortunate that this is part of what happens. There are bad therapists out there. I can't deny it. I won't deny it. I will never BS people and say that every therapist is, magical and rainbows and sunbeams, because there are some bad folks out there. And then Kathleen says she totally emphasizes with that. It emotionally takes a lot of you to seek people out, and when they turn you down, it's so disheartening. Like with depression, it's hard to start the process to begin with, and then you want to turn away, it could sink into it. And yes, that is a very, very fair and important comment, because, no matter how hard you try, if you go through a bunch of bad experiences, it's going to not only make things harder for you, but it's going to be harder and harder and more difficult to actually get back up and find the motivation to find the right therapist. And that's why I really just make the call and the cry out to therapists to say, be good, be respectful, and leave the narcissism, the arrogance, and everything behind. But it's unfortunate. It just does not happen that way. So, I mean, there's just no other way to say it. That's why I like to, use the phone call as a time to, really try to make a difference and see if what you're getting into is going to work for you. Okay. One of the things you will go through is what we call informed consent and confidentiality. Informed consent is basically telling you these are the potential benefits of therapy, these are the potential risks of therapy, but it's also going to include something called confidentiality. Confidentiality it's an important thing for you to understand, and it should be gone over the very, very first day, because if not, it can lead to some really sticky and ugly situations. Now, confidentiality comes down to a couple of things, and it says that I'll give you an example of how I would explain it. Again, my fictional individual, Jennifer, I would say, okay, well, Jennifer, I'd like to talk to you a little bit about what I can and cannot do as far as confidentiality is concerned. I want to assure you that everything that you and I talk about will stay between you and I. This is your safe space. This is your place to be able to expand and discover things. But there are some limits to what I can and cannot keep secrets. One of those limits is when it comes to called duty to warn. If you present a significant risk that you might harm yourself, such as feeling suicidal or seriously self-harming, or if you should present a risk to someone else, such as feeling homicidal or wanting to harm someone else, then, we'll talk about it, we'll work through it, but ultimately, if the risk continues and you become an imminent danger, then I do have to make a report. Also, something else that has to be remembered is that if there's ever child abuse involved that you're a part of, I do have to make the appropriate calls to places like DCFS, because we're concerned about safety of children. Children are not the only protected status. The other two protected statuses include elders and also people who suffer disabilities, both physical and mental. So if you present a significant harm via neglect or abuse to any of those three protected statuses, then that's something that has to be reported. And I understand that this, can sound a little bit concerning, but I want you to know that beyond that, I want you to know that, what's between you and I is going to stay between you and I. And I only do these things for safety, and that's really what it comes down to. Kathleen says, we kind of need our hand held a little bit, and it's hard to say that because there are sadly therapists that are not there for the right reasons, but no one seeks out a therapist who have no mental issues. It would defeat the purpose. I know if someone is abusing drugs, it has to be reported. Well, it depends on what's actually meant by abuse. If a child is abusing drugs and it's causing a danger, then there may have to be a report to family members. However, I have many, many clients that are abusing drugs that stays between me and my client. Somebody that I see quite frequently is abusing drugs, and that's not necessarily as significant of a risk, and it's a real muddy water, unfortunately, of how confidentiality works. And as a matter of fact, I could almost make that a whole live stream itself. So, but good comments, definitely. And that's why I say do not fear. And one of the things about confidentiality is people that come in and tell me, that they are actively suicidal and thinking about ending their lives or harming themselves in a significant way. The initial thought might be, well, how dare you? You told me that you're here for my protection and here for my safety, and I'm trying to open up to you. And as hard as it is to have the conversation, I think it's just as important for me to point out the fact that, well, if I am indeed here for your safety, then philosophically, logically speaking, I would not want you to end your life, because your safety and security are my number one priority. And part of that safety and security is to, make sure that you maintain a non-self-harmful position. So it is really, really important. Okay. Will I make that a live stream confidentiality? I'm interested in that process. Yeah, I could definitely make that a live stream. That may even be something I can pop up later this weekend, and we'll definitely take a look into that. So, all right. So day 2, for those of you who are just joining us and missed the link, here's what you're following. And another link I'd love to drop for you is that if you want to watch reruns of the live streams I'm doing, all episodes are being put on YouTube, and eventually will also be part of the podcast that I'm going to run. So let's talk about day 2 and beyond. So therapy has begun, you're starting to get deep into it, and you're starting to do discovery, look at patterns, do homework assignments, and all sorts of stuff are happening to help the healing process. Something that I tell people the very first day, and it is extraordinarily vital. No matter what you think, you will have fallbacks when you're in therapy. You will regress at some point in time. I have never seen even a slight percentage of people that have come into therapy that have not had a fallback. It's really, really important that you understand that these fallbacks happen. And one of the most important things you can do when a fallback happens is keep coming. So long, of course, so long as you are not in like an abusive relationship with the therapist, but to keep coming, because when these fallbacks happen, the greatest way to increase strength and find empowerment is to actually continue working through the process. So the fallbacks are going to happen. You have to know that from day 1. There's a lot of different therapy styles, too, to consider. But a lot of them come down to a couple different things. One is symptom reduction, trying to bring back the symptoms of trauma, depression, bipolar, anxiety, whatever it is. And then also, there's self-discovery. In self-discovery, there's hundreds of different psychological schools, such as analysis, existentialism, CBT, DBT. There's all sorts of stuff out there that, is probably another live stream I can pop out, like what you should expect when you go into certain types of therapies. There is no cookie-cutter approach, and there should not be a cookie-cutter approach. If you come in and have the exact same trauma as someone halfway around the world, at the same age, the same time of the day, I guarantee you will not respond in the exact same way. And one of the things that I like to use as an example that's a little less triggering than talking about something like sexual abuse is, imagine if you had 5 people who were all 25 years old, white male, had the exact same upbringing, had the exact same triumphs in their lives, the same, tragedies in their lives, and you put them in a room. 5 minutes into them sitting there, a tornado rips through the building and rips off the back wall. No injuries whatsoever. It is not true that all 5 people who have had these same upbringings are going to experience that tornado in the exact same way. Some people, due to their makeup and how things went in their early life, may look at it as, okay, that was frightening, but I lived, and we're going to be okay. They can kind of make logic out of it, that it's not something that happens very often, I'm going to be fine. Some people might have some, a little bit heavier reactions, like, oh my God, that was really frightening, I hope that never happens to me again. And then then some people, again, who have the same upbringing and different chemistries and just different protective factors may have an extraordinarily traumatic reenactment of the event, and the rest of their life could be severely affected. So no, there should never be a cookie cutter approach. It should be personalized. Every person in this channel, if they were my client and all suffered depression, are going to be treated differently because of the fact that you are not the same person as the next client that walks in the door. And so there's a lot. So those clinical blocks, again, talking about, having the fallbacks and the regressions, are important to continue through. Now, one of the most beautiful things about therapy is that not only the cathartic experience and the guidance and the help that you're in, the coping that you're finding, but one of the most beautiful things about therapy is that as you go along and begin to start solving some of the problems that have been causing you such heartache, anxiety, depression, whatever it might be, is that you're going to actually find a surprise that on the back end of working through these things that you're a lot stronger than you thought you were. And I applaud everybody that goes into therapy because of the fact that just walking through the door and talking that first day about the bad things going on is difficult. And you had the courage to actually go into a process that you knew was going to be difficult, but you decided you had had enough, and this is not how things are going to be. So that's pretty intense to me. I think this is such a beautiful experience. Because really, ultimately, the psychiatrist that I used to work for once told me that, he said, Dan, a psychotherapist job is not to, to tell you what to do, how to do things. A psychotherapist job is simply to help you find the answers that you already know. Because no therapist should ever tell you what to do. No therapist should ever be telling you this is what you're supposed to think. Instead, they're supposed to float some ideas, provide guidance for you to be able to find out what you need. Still talking to you one-on-one. Yes, I absolutely plan to, with the opening of the PTSD clinic and a lot of things happening, I've definitely been very busy, so I do apologize about that, but I've got definitely a lot I'd love to talk to you about. So let's also talk about how to know that you have the right therapist, because this is just as important. And knowing whether you have the right therapist is not something that you check in once when you begin and then never think about it again. You should always be considering this. Not to say that you should every day walk into and judging the therapist and saying, like, all right, I'm watching for you, blah, blah, blah. But instead making sure that you guys are working out that you're right for them, that they're right for you. And there's, a lot of different red flags that can be done or that can be seen. But the main thing is, how do you actually feel? Do you feel that this person has an abusive or judgmental tone? Do you feel this person is telling you, no, 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 or yes, 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 and forcing decisions on you? But it doesn't even have to be anything that severe and distinct. Instead, it can be something a little bit more vague, and some of the things that can happen when therapy is just not right is that the therapist is good, you're good, but you're just not a good match. I have a tendency to take a very bold approach once I get to know people, and some people don't necessarily appreciate the bold approach, so it doesn't necessarily mean that I'm bad at what I do, or that the client is a bad person. It just means that we don't necessarily match in our styles. At the same point, something you should also know is that if you have a fallback and you're starting to think that the therapist might be the problem, always talk it out if you feel safe talking with the therapist, but also talk it out with yourself. Take a moment and try to figure out, am I just having a really bad moment and looking to blame on someone else, or is this person actually potentially causing me damage, or at the very least not doing me any good? So there's a lot to think about there. So I'm going to go ahead and pause for a second and just talk a little bit about some other things while I give you guys some moments to see if you have any questions right now. So if you have some questions, any point in time, throw them out. But if you have some questions at the moment, let me know about what we've discussed thus far. There's definitely a lot of ground to cover, and as you can see, just in doing this, I've already come up with 2 new live stream ideas that I want to work on. So I'm really interested in getting the podcast started. I've got everything I already need right now. I have a really good microphone that we've had for quite some time. I've got the headphones. I've got the, been downloading the software and playing around. So obviously you guys will be notified as when the podcast is planning on going up. But again, a little bit of shameless self-promotion. If you'd like to, like I said, all live streams will be placed here after we're done, usually within about an hour. I would love for you guys to subscribe to the YouTube channel. There it is right there, and then there will be the red subscribe button. And you can hit that button, and then it'll update whenever I add a live stream or any sort of video up there. So I'm not seeing any questions just yet, so I am going to press on, but if one does pop up, I will go ahead and attend to that question and pause what I'm doing. So let's talk about one of the biggest, scariest parts of the process. What happens when therapy is done, and how do you know if therapy is done? Okay, so this is going to sound very, very cliche, and as I put up in the blog itself, offhand, I would say at least 80 to 90% of people ask me the question within the first couple of days, how long is this actually going to take? And it's a legitimate question, and it has a cliche answer, but I'm going to give you the cliche answer, but also expand a little bit, and the answer is that you will know when you know. Now, realistically, as I say, it is a lot more involved to that, but there are some signs that you can look for. One of the signs is that if you've covered so much stuff that every time you talk to me as a therapist, as a client, and all we're doing is just BSing and going back and forth with things that are very, very trivial, but it's not hiding a bunch of deeper stuff, then that might be time to start thinking about wrapping up, or at least at the very least lessening the times that you come, lessening the frequency. Because obviously, as much as it can be interesting, you don't want to be wasting, co-pays on money, just, having a BS or event session back and forth. One of the big ways you can know that you're done is if you find yourself successfully and appropriately solving your own issues without necessarily the need of reaching out to the therapist or the doctor. Because if you've gotten to the point where you're such an expert on yourself and an expert on treating yourself, that you can do everything without the physical hands-on face-to-face guidance, then to me, you've gotten to a point where you can start thinking about wrapping up. And of course, if something new comes up or something gets exacerbated, then by all means keep going. You should never be forced out, but you should never also just hang on, for, ages and ages. And one of the things I say down here is we request always that that clients discuss with us before they leave prematurely. And as I say, it's not an ego trip, but we'd like to know what about the process isn't working for you. Because if you come and straight tell me that, I don't think, it's working out with me, and whether you want to discuss why it's working out or not, I will, be the person to tell you that, okay, let's try to find out what is going to work for you. And then once you've gotten out of therapy and left and you've had your last session, now what? You sit there and you might ask me like, well, okay, you've talked about fallbacks. Are fallbacks going to continue to happen even after I've gone through maybe a year of therapy or something and solved all these issues? Of course they're going to happen. And you have to know that that's part of life. And there's two ways to think about going about this process of having a fallback outside of therapy. One of the problems I have is that people don't realize that when therapy ends, it doesn't mean it's 100% over. There are things called booster sessions, meaning I'm not going to restart therapy with you, but hey, I had a couple of bad months, and I'm thinking maybe I need to refresh some things. So you can come in for a 1 or 2 time thing, or maybe come in for only like 4 sessions and kind of refresh what you've learned and, get things taken care of. Jay says, I feel like I've self-treated a lot with my issue, but still find myself sometimes having panic and anxiety attacks and do not know how to properly deal with them. Well, and that's a really important comment, so let me go ahead and talk to that for a second. Whether it's anxiety, depression, mania, whatever it is, it's not always as easy to take care of yourself, and there's really 2 reasons for that. 1, because we're biased by our own opinions, and 2, because it's very hard for us to see anything outside of ourselves. And that isn't to suggest that we're ignorant or stupid about humanity and the types of people that we are, but it's more to suggest the fact that when you see what you see, regardless of how awakened you are, you're always going to see them almost through your own rose-colored or, not so nice colored glasses. So it's a good idea that if you have a problem and you think it's significant enough, turning to someone else to talk to, can be really good. And one of the reasons we go to professionals and not family members or friends is because of the fact that professionals offer a few things that family and friends can't. And part of it, yes, it does again sound like a bit of an ego trip, but we are educated, we're practiced, we're vetted, you know, we know what we're doing, we've done this many times before, but more importantly, family members and friends and colleagues and co-workers, try as they might, they're going to have biases about you, and sometimes it's a bias in a good way, and it sounds strange to say, but a bias in a good way is not always a good thing if you're trying to heal things. So imagine if you're going through anxiety and panic, such as Jay talks about, and you know, you go to a family member and they're extremely biased in the positive towards you. This might be somebody who wants to see the best for you, but maybe looking past, you know, the issues and trying to solve problems for you as opposed to giving you time to vent. So, you know, that's part of, you know, a large part of what the therapeutic process is that cathartic experience, and having someone who's not just going to return back and say, well, do this, do this, do this. Because I can't even count to you how many times I've heard therapists say the problem then is I try to talk to other people and they want to solve my problem, and I'm not looking to have my problem solved by them. I just want someone who's going to listen, and that is such a large part of what we do here. So, you know, it is definitely a good way to look into, you know, what's looking into professional help. So again, if another question comes up, that's great, but you know, so another thing to think about is after therapy's over, if you find a brand new presenting issue, then there's nothing wrong with restarting therapy. Who knows none of their background, and that is an extraordinarily important and relevant and intelligent thing to say, because someone who doesn't know your background is exactly who you need, because at that point in time, I'm not going to come in with all these judgments and biases because I know you so darn well. So yeah, very, very good, good comment there. So yeah, you know, sometimes people have to go back to therapy in full force because of a brand new presenting problem. You know, continue to be aware of who you are and where you are. Harley asks, what if in the middle of the therapy you are not getting what you need? Do you ask your current one to recommend someone, or do you start the process all over again? And really, that comes to your comfort level. And the comfort level, really, you have to ask yourself, is this somebody I'm comfortable enough to say, like, hey, Dan, you know, I like you for who you are, you're a good professional, but the problem is I'm just not seeing what I need out of this. And a good therapist should help you find somebody else to go to. They should be comfortable professionally, ethically, personally to say, hey, okay, well, that was kind of a depressing thing that it just kicked out on me at the very last second. So this is going to have to be kind of a two-parter. It logged me out of my session. That really sucked, but ouch. I'm going to have to probably get a video editor and combine these two things before I actually put together the video and put it up on Livestream. So, oof, that was kind of painful. Hopefully you guys find the new link and you get to it. But that was definitely not how I wanted that to go. And for some reason now I'm all of a sudden getting, getting some sort of feedback. So, that's really terrible. I don't know where this feedback is coming from, but it told me that my session expired, and that really sucked. So again, before this goes up, I'm going to actually have to paste these two videos together with some sort of editor. That really blows. So ouch, nothing I can really do about that. But Harley did ask, you know, what do you do if you find out that this is not right for you and it's not getting what you need? And the answer that I was aiming for was to say that you should ask your therapist, if you can, for somebody that they think might work better for you. And then, of course, if you don't feel safe asking that, then yes, unfortunately, you may have to start the process over. So yeah. So I'm going to go ahead and kind of talk about the final word here and give you guys one last moment for questions before I end. So the final word is, as I posted, is that remember that the best advocate for your mental health is always going to be you. And it's not to say that we want you to obsess over your mental health, but more so that we want you to learn the ins and outs of the therapy process, learn the ins and outs of you, and, find out what's important to you, what's helpful, what's not helpful, and remember to always ask questions if you feel that there's a question to be asked, because the only person that's truly going to be your best advocate is you. So I'm going to give you guys another moment to see if you have any questions before I close out. As always on my page, I will update when the next video is going to go, and we'll kind of pick up from there. So I'm going to give you guys a moment to see if you have any questions. And again, so sorry that happened. I don't know why I ditched out, but my software told me that I had a session expire. I don't even know what that means, but there you go. So, not seeing anything just yet, so I think I am going to go ahead and wrap this up here and then get to some video editing. But first things first, again, I'd like to thank you all for being here. Sorry for that little technical glitch that we had, but unfortunately that sometimes happens. So for those of you who joined us, I really am appreciative, and either later this week or next weekend, we'll be talking about some more information. At any point in time, you can get on the YouTube channel, which I've posted, but I'll also put it in here. And the YouTube channel, please feel free to subscribe. I'd love to have you guys there. And it'll give you guys ideas of when I posted new stuff. So to all of you who joined us, thank you very much, and appreciate it, and have a good day.